Today's topics are specific phobias. What are specific phobias? Many of us have a fear of one thing or another, whether it be fear of heights, the dark, or spiders. What constitutes a phobia, and how does it differ from regular fears? Specific phobias must be irrational fears. The fears must exceed the potential danger. They must be persistent and consistent, which can disrupt everyday life. This can lead to constant anxiety or panic. Common phobias include a fear of animals or events in the natural environment, such as thunder. More uncommon phobias, sometimes more problematic phobias, include agoraphobia, which hinders a person from being in large crowds, and social phobias, where a person fears social interactions. Some common treatments for specific phobias include hypnotherapy, cognitive behavioral therapy, or exposure therapy, supportive therapy, and family therapy. In hypnotherapy, psychologists put patients into a deeply relaxed state. This relaxed state is a trance-like state where a person's consciousness is less active, but the unconsciousness is still receiving information. Here, psychologists try to persuade or encourage patients to become less fearful of their phobias. In exposure therapy, specifically in vivo exposure therapy, the focus is on desensitizing patients on their phobias by slowly exposing them to related stimuli. The stimuli increases in intensity as the therapy progresses, the goal being so that the patient becomes less scared of all related stimuli, and finally, the phobia. Supportive and family therapy are important so that the patient does not feel isolated, ashamed, and misunderstood while dealing with their phobias. There are some issues with how phobias are being treated. Hypnotherapy or cognitive hypnotherapy lack research studies that show their efficacy in treating phobias. Proper control groups and sample sizes are also lacking. In vivo exposure therapy for specific phobias faces reluctance of patients being exposed to their phobias and significant dropout rates. Without participation in these therapies, family and supportive therapies do nothing. A good alternative for these therapies, more specific in vivo exposure therapy, is virtual reality exposure therapy. Virtual reality exposure therapy helps patients to gradually become desensitized to their phobia without directly exposing the patient to their phobias. Instead, this therapy puts the patient in a virtual environment with virtual stimuli where the therapist has control over what is or what is not present in the virtual environment. Virtual reality exposure therapy. Why is it better than other treatments? Patients are more willing and less anxious to try virtual reality exposure therapy than in vivo exposure therapy. This may be because they know they will not be directly exposed to their phobias. Virtual reality can expose patients with phobias that otherwise would be difficult to treat without virtual reality, such as a phobia for heights and for flying. It is also more convenient since there's no travel time. The therapy is less public, so there's more privacy. The therapy can present stimuli that can be adjusted to the patient's specific needs, providing predictable scenarios. Here are the sources used for this presentation.